How do you get out of the pain? It hurts. There's something I call the highway to healing, and that's how you get out of this. There's a very specific, concrete method for you to get out of pain. Remember, it's a psychophysical activity. It starts psychologically, so the cure, it isn't surgery, it isn't drugs, it isn't physical therapy, it isn't hanging upside down by some contraption to try and lengthen your spine. The cure is also psychological. So the first thing is to completely understand what's going on. The purpose of diversion pain syndrome is to divert your attention from some unbearable emotion to something physical like pain. Understand the process. And then you must renounce the anatomical structural diagnosis. By the time you've come to me, you've probably seen doctors and maybe surgeons and acupuncturists and physical therapists and chiropractors, and you've probably been given some structural diagnosis or diagnosed with something like fibromyalgia. The very first step, and absolutely mandatory to your getting better and feeling better, is to renounce the structural diagnosis. The next step is to acknowledge that the real cause is psychological. It's diversion pain syndrome. It has a purpose. It's making my blood vessels smaller, it's reducing my blood flow, and it's the oxygen deprivation that's the cause of my pain. It's benign. There's nothing wrong with your back, there's nothing wrong with your neck. Diversion pain syndrome is psychological. So at first, renounce the anatomical structural diagnosis and then acknowledge that the real cause is psychological. And then the big key is to focus on your emotions. When your unconscious mind gets that you consciously get the emotion that's been repressed, your pain disappears just like that. Focus on your emotions. Your unconscious mind is saying, hey, pay attention to this pain, it hurts, it hurts, it hurts. That's not going to help you. When it hurts, focus on your emotions. Start to focus on the emotions you're feeling at that time. And then there's a really good trick, speak with your brain. You might want to be careful where you do that. You don't want to end up in a rubber room, but it's really important to speak with your brain. Tell your brain, I know what you're doing. I get it. You're trying to give me pain so that I won't focus on my emotions. And the more you do that, the more you speak with your brain, believe it or not, your pain will go down. It's an amazing process. And then the final point in the highway to healing is to commence normal, regular physical activity as soon as possible. Because if you really believe that the cause of your pain is diversion pain syndrome, that means you really believe that there is nothing structurally wrong with you and physical activity cannot hurt you. So therefore, the sooner you commence regular physical activity, the sooner you're on the highway to healing.